The community health nurse educates a group of young boys who are learning about hiking safety. Which of the following statements made by the nurse is not effective for preventing Lyme disease? A. You should be aware of where ticks infected with Lyme disease are located, particularly in the upper Midwest, New England, and the Mid-Atlantic region. B. You can take antibiotic medications before hiking to make sure you don't get Lyme disease. C. You should wear insect repellent on your skin and clothes if you are in an area endemic to Lyme disease. D. Try to cover as much of your skin as possible, long pants, long sleeves, long socks, and cover your neck and hands too. E. After you hike in a Lyme disease endemic area, carefully examine your skin for ticks. The answer is B. You can take antibiotic medications before hiking to make sure you don't get Lyme disease. Prophylactic antibiotics are not indicated for the prevention of Lyme disease. Antibiotics will be used after a tick bite when symptoms develop and an infection is suspected. The community health nurse should teach rules of prevention, including 1. Knowing where Lyme disease is prevalent, New England, Upper Midwest, Mid-Atlantic states. 2. Wearing long sleeves and long pants, covering as much skin as possible with clothing. 3. Using insect repellents such as sprays over the whole body, and 4. Checking for tick bites especially after exposure is anticipated, so you may receive care as quickly as possible if needed. Which of the following should be restricted in a patient with end-stage renal failure? A. Fluids. B. Protein. C. Potassium. D. All of these are correct. The answer is D. All of these are correct. A patient with end-stage renal failure should be kept on a low-protein, low-potassium diet. Fluid restriction is also an important part of management of patients with end-stage renal failure and patients on dialysis. A 75-year-old female with end-stage renal failure asks her nurse for advice about her diet. Knowing that this patient must adhere to a low-potassium diet, the nurse cautions her against which of the following foods? A. Eggplant. B. Cherries. C. Orange juice. D. Apples. The answer is C. Orange juice. Orange juice is very high in potassium. 1 12 ounces glass of orange juice contains 705 milligrams of potassium. This could easily increase blood potassium to dangerous levels. The other fruits and vegetables listed are all low potassium foods suitable for consumption by individuals needing to follow a low potassium diet. A nurse is looking over a basic metabolic panel for a 69-year-old male. She notices that his bun is 12 milligrams per deciliter. This value is dash. A. Normal. B. Depressed. C. Borderline elevated. D. Elevated. The answer is A. Normal. BUN, or blood urea nitrogen, is a measurement of the kidney's ability to excrete urea, which is a byproduct of protein metabolism. This patient's BUN is within normal range. The reference range for BUN is 7 to 20 milligrams per deciliter. You are the nurse taking care of an elderly patient with severe dementia and limited mobility who is at a high risk for developing a pressure ulcer. Which of the following options is the best first-line approach to preventing development of a pressure ulcer in this patient? A. Turning the patient multiple times per day. B. Applying topical antibiotic ointment to cover the patient's entire body surface. C. Administering broad-spectrum intravenous antibiotics. D. Request a dermatology consult. E. Administer a one-time dose of broad-spectrum intramuscular antibiotics. The answer is A. Turning the patient multiple times per day. In the preventive stage for pressure ulcer management, there is no need to perform any invasive procedures, administer antibiotics in a patient who may be at high risk for needing broad-spectrum antibiotics in the future, hence fostering antibiotic resistance, or consult subspecialty services, as there is no dermatological condition to be treated at the moment. The best option to prevent a pressure ulcer in a patient who is at high risk for developing a pressure ulcer is to turn the patient regularly while they are in bed, if they are bedbound. By turning the patient, the high pressure areas that would be at the highest risk for development of a pressure ulcer are able to have relief from pressure for a greater proportion of the day, night, and as such, can have blood flow restored while the patient is turned. By allowing for maximal blood flow to these regions, the risk of ischemia and subsequent infection and/or ulcer development is decreased. Without the actual development of an ulcer or infection, administering antibiotics, either topically, intramuscularly, or intravenously is inappropriate.